Hello, everybody. A warm welcome to you all on today, day 2 of the virtual Not Without FP Forum for the International Conference for Family Planning. You are joining this special side session hosted by FHI 360 and the Research for Scalable Solutions project entitled Advancing Equity to Support UHC, Tools and Approaches for Next Gen FP, which is a hashtag that you can tweet. We're so happy to have you all with us today. My name is Trinity Zan. I am the lead for research utilization on the Research for Scalable Solutions project, and I will be one of the moderators today. And I would like to introduce my co-moderator, Helen.
Thanks, Trinity. Hello, everyone. My name is Helen Anyasi. I am Senior Technical Officer, Reproductive Health at FHI 360 Nigeria office. I also serve as the technical lead for HIV testing and PrEP services in the USAID-funded CEDARS Nigeria project. To move us along, we will engage in what I hope is a fun activity for us all. Please follow the instructions on the screen right now. If you have not already, please go to www.menti.com. Use the code 393177. When you get there, please describe in a word or a phrase why equity in family planning is important for universal health care. Let me just give you all a moment to get there. It's www.menti.com. Use the code 393177. Great, we have someone in, and we've got justice, rights. Okay, as soon as we have more.
It's also written in the chat if you would like to look at that to see the website and the code.
Great. Those are excellent words that describe equity, dignity. Dignity in pink, it's nice and colorful. Human rights. Our rights is getting larger, meaning that a lot more people are adding on rights. It's essential. Yeah, rights is a big one. Just to let you know how it works, the more people that add on the same word, that word gets larger in the word cloud. So, okay. All right. Fantastic. Please leave the Menti page open on your device because we'll be using it again as we move along on the agenda. Trinity, it's over to you.
Thank you. Thanks, everyone. And I really like seeing those answers. We're really hopeful that we can use some activities to make this interactive, recognizing that our time is quite tight and we won't have a lot of time for questions and answers. So we do look forward to your engagement. I have the pleasure of introducing our first speaker who will open this session. Erica Huftaling is a social science advisor in the Bureau for Global Health at USAID. She supports the social and implementation science research portfolio in the Office of Population and Reproductive Health. She's also the alternate AOR for the R4S project, and it's my pleasure to welcome you, Erica. Over to you.
Thank you, Trinity, and hello, everyone. I'm delighted to be here to represent the Research for Scalable Solutions USAID management team. And I want to start by addressing the poll question: why is equity and family planning important for universal health coverage? There were many great responses, and I think that all of us can agree that there must be universal access to a broad range of contraceptives, including information and quality services, in order to attain universal health coverage. All of us here today also know that innovations in family planning programming have resulted in significant increases in contraceptive prevalence among women and girls around the world. However, hundreds of millions of women and girls still have an unmet need for modern contraception. Therefore, realizing universal access to contraception will require the need for greater focus and investment to understand and address barriers, especially inequities faced in accessing and using voluntary family planning. Now, taking a step back, you might be asking yourself, what exactly do we mean by equity in family planning? Unlike other health interventions, equitable access to family planning services does not mean that all groups use contraception at equal rates. Rather, equity implies that all groups have the same access to information and quality services, including access to all available methods of contraception, their removal, and high quality care that includes equal treatment by providers. Further, equity implies that women and men, including adolescents and young people, can make decisions about their fertility and their use of contraceptives and act on those decisions. Uniformly high use of contraception is equitable only if it adheres to the choices of individuals in all groups. So, how do we go about reducing inequities in family planning programs? This is a challenging question, but today's session will discuss how to further define, measure, address, and monitor equity within family planning programs and research. We will hear from experts on how to identify inequities in a family planning program, how to formulate a plan to address those inequities, and how to know if we're making a difference. Our presenters today come from a range of countries and organizations, which just goes to show the importance of having all hands on deck to tackle this issue. Finally, I'm sure many of you are aware of the high impact practices in family planning, also known as the HIPs. While we won't delve deeply into specific practices today, there are a number of high impact practices that can address inequity issues related to expanding method choice or coverage, reaching underserved populations, and reducing financial barriers. For example, community health workers are particularly important to reducing inequities in access to services by bringing information, services, and supplies to women and men in the communities where they live and work, rather than requiring them to visit health facilities, which may be distant or otherwise inaccessible. And the Health Extension Program in Ethiopia is a great example of this. Additionally, the HIPS partnership will be publishing a strategic planning guide to help decision makers identify and develop approaches to address inequities in family planning. And the Research for Scalable Solutions project will be standing up a task force on equity to continue tackling these challenges. So more to come on both of these later this year. And with that, I turn it back over to our moderators. Thank you so much and enjoy the session.
Thank you, Erica. Thanks for really providing that solid overview and a foundation for the themes that are going to emerge in the remaining presentations and discussions today. I'd like to now whet your appetite for some of the content that our next speaker, Kaya, will be presenting, and ask you all to go back to the Menti. So as a reminder, it's on the screen and in your chat, www.menti.com, and you can use the code 393177, or if you used it before, hopefully it'll just refresh on your device. And we'd like to ask you, which of these do you think are important dimensions of equity to consider in a family planning program? And pick as many as you want. So there should be multiple options on your screen. They disappeared from here for our choices, but you can choose wealth, sex, age, education, marital status, language, disability, religion, geographic location. So as you can see, we are populating that as we speak. Right now, we've got the most votes for geographic location and sex, which seem to be holding first and second spots respectively. But a good variety of people feeling that these dimensions are all important, perhaps in lower rank, at least according to those of us on this particular session, would be religion. So very interesting. And of course, if you have thoughts on other dimensions that you think are particularly important that you don't see here, feel free to put those in the chat. Well, thank you so much for participating in this, and I will hand it back over to Helen. Thanks, Helen.
Thanks, Trinity. That was truly interesting. Next, we have a brief presentation from Kaya Uruzinska. Kaya is a senior technical advisor at Palladium, working on the USAID-funded HP Plus project. Under the HP Plus project, she contributes to generating new evidence and models, tools to bolster family planning investments. She most recently led a team in the development of a replicable approach for diagnosing inequity in family planning at national and subnational levels, called the Family Planning Equity Tool. She will be talking to us about this tool. Do go ahead, Kaya.
Thank you very much, Helen, and greetings, everyone. So as Helen mentioned, today I'm going to be speaking to you all about how we identify inequities in family planning programs through the tools that we as a community have available, including a new tool that we've developed under the Health Policy Plus project funded by USAID. Next slide, please. So we've already discussed this a little bit, or Eric has discussed this issue a little bit for us already, but I wanted to dive a little bit more into equity and family planning. So we know that equity originates from the right to the highest attainable standard of health, which you can see on the left side here. And their equity means that everyone has a fair opportunity to reach their health potential, regardless of your wealth, education, marital status, or any other status and group. The right to health, of course, includes family planning, information services, and supplies. But I think we sometimes forget that in addition to equity in different areas of health, we're also entitled to equity in health care. And so those are the programmatic elements that ultimately shape our health outcomes. And so those are things like the availability of a wide range of family planning methods and information on health facilities. It includes physical and financial accessibility, acceptability, and of course, the quality of your services. And together that's known as AAAQ. And this holistic perspective is, I think, really well captured in the quote that you see on the right-hand side here from the FP 2020 Rights and Empowerment Working Group. And you can find out more about equity and family planning in a recent discussion paper on equity for the High Impact Practices Partnership, which Erica also mentioned. Next slide, please. So there are a number of approaches and tools that we have available for interrogating inequities in health, and they typically fall in the two categories that you see here. So first we have cross-tabulations or tabulation tools, which are really popular for examining differences. And those are tables that summarize two variables with multiple categories. So that can be contraceptive use and wealth category, for instance. And we see here that they're produced by institutions like PMA and of course the demographic and health surveys, and they enable you to view these typically online, really easy formats. Then there are approaches that utilize inferential statistics, where we examine not just the relationship between, from the previous example, contraceptive use and wealth category, but we can actually see whether that difference is statistically significant. One notable tool that we flag here is the WHO's HEAT Plus toolkit, which is really a fantastic resource that enables users to assess what they call inequalities at the national and at the subnational level for a range of health issues, including family planning. And you can use different statistical methods, and they make them very available to the user, and they enable you to select your option, and a lot of the computations happen automatically. So to this, we've just recently added HP Plus's new instrument, the Family Planning Equity Tool, which, as you can see here, can be used to diagnose inequities in different components of family planning programming, not only at the national level, but at the subnational level as well. On the next slide, we'll learn a little bit more about our tool. And what it does is it identifies inequities in family planning for a range of commonly disadvantaged subgroups, not just women who are poor, for example, but a much wider range for various components of family planning. So it enables us to go beyond use alone. And importantly, we're able to assess this not only at the national level, but at the subnational level, which is where we know, of course, that a lot of the decisions are made today for family planning programming. So what the HP Plus tool effectively does is it answers the who, what, and where of inequities in family planning. And that level of specificity is really important for guiding decisions around funding, the design of programs, and the actual implementation of family planning projects themselves. So you can find this tool on the HP Plus website, and what it consists of is code that you run in R, which is an open source statistical program. But to that, you get step-by-step instructions about how to actually do it for any country that has a demographic and health survey. So we like to think that this is actually very user-friendly, even if you're completely new to R, thanks to the step-by-step instructions. And the tool identifies inequities by automatically running statistical computations for the user following setup. And what we do then is examine the experience of 7 commonly disadvantaged groups of women in 5 dimensions of family planning. And the results are automatically generated for you. They exist in Excel, where you get different signposts for how to interpret those results. And then we also produce accompanying maps and visuals, charts that you could use as well. Next slide, please. So to understand who is affected by inequities in health and family planning specifically, as I mentioned, we compared the experience of 7 commonly disadvantaged women to their counterparts. And so we compare the least educated to the most, the youngest to older, the poorest to richest, not married to currently married, minority ethnicity groups and religious groups to majorities, and then rural residents to urban. Next slide. And then to understand which components of family planning are not being delivered equitably, the tool examines the experience of those women that I just mentioned in each of these components of family planning. Again, we're going way beyond use here. So we're taking a look at access to information, access to services, the acceptability of the services, the family planning services that you're receiving, the quality of those services, and of course, at the end, we include use measured as demand for family planning satisfied with modern methods. Next slide, please. And finally, we need to know where inequities are occurring. So for any country in which this approach is applied, you can generate results at 3 different levels. At the national level here, so you understand who's experiencing inequities and for what components. And then at the subnational level, you can understand and see the distribution of inequity by different regions in your country. And then you can actually also zoom into your specific region and take a look at that very detailed inequity profile. And the depth of the analysis is, the one limitation is that it's dependent on the sampling approach by the DHS. Let's take a look at the next slide. So we actually applied this approach in Uganda. So in the figure on the left, this is just one of the select results that you can generate through this approach. So each row here represents one of the disadvantaged groups of women, and each column represents one of the family planning components. And so take a look at where you see the orange. And what this analysis shows us for Uganda at the national level is that the least educated women experience the most inequitable conditions. So that means that they experience inequities compared to more educated women in each component of family planning. So that is for access to information, access to service, acceptability, and so forth. By comparison, if you look at the gray, women who live in rural areas and religious minorities experience relatively equal conditions compared to their counterparts. If we take a look at the graph on the right, the visual, we can take a look at the regional details. So if we pay attention to the orange, those are again the regions that are most affected by inequities for the different components of family planning. And so we can see here that Acholi, for instance, as well as Bugishu and Bonyoro have the most inequitable conditions. And the final slide, please. So how can these findings be useful? Well, from the policy perspective, results can be used as evidence for your post FP 2020 or now FP 2030 commitments. You can use them to guide your major commitment in a family planning cost implementation plan, for example, helping articulate who need to be the beneficiaries or where do we need to focus our effort. You can also use this for funding. So findings can be used to justify where you mobilize resources, where you allocate them, where they're prioritized, either by program component or for the type of beneficiary. And then finally, this approach can be used as evidence to design more tailored interventions that are responsive to the unique needs of different population or subnational units. To learn more about this approach, you can download it for free on the HP Plus website and on our models page. And thank you very much for your time.
Thank you so much, Kaya, for walking us through this tool and getting us to think through ways we can spot inequities in implementing family planning programs. Thank you so much, Kaya. Well, I hope you still have Menti open because we have another question for you related to the presentations we have just listened to. So if you are Menti, you follow the instructions on the screen. Have you used any of the following to identify inequities in your family planning program? So have you used large data sets like DHS or PMA data, or routine HMIS data, quantitative data from research studies, or qualitative data from research studies done in country, in your country? I see that a lot of people use large DHS or PMA data. That's fantastic. Then we do have some people that have never really looked into using data to identify inequity. And I hope that Kaya's presentation great to see the many ways that we're seeking out inequities in our programming. Also good to see that a lot of programs or programmers are using data. We have more people saying that they use data sets like DHS and PMA. If there are other data sets that you use, you can please put that in the chat box and continue conversation over there. Well done. Trinity?
Great, thank you so much, Helen. And I'm seeing some really good and very thoughtful questions and comments coming through the chat. So thank you. And of course, you all are welcome to respond to each other. And as time permits, our speakers will also try to respond to your questions coming through. Well, it is now my great pleasure to introduce our next speaker, Dr. Charles Olaro, who is the Director of Curative Services at the Uganda Ministry of Health. He oversees the maternal and child health services, which include family planning and the relevant technical working groups, including the family planning technical working group. So as you can imagine, he is well placed to speak to many of these issues. It also means that he oversees the CIP, or the Costed Implementation Plan, development and guidelines for implementation of family planning services in the country. So we're very much looking forward to his remarks about how we can move from identifying inequities to creating a plan. So welcome, Dr. Olaro. Over to you.
Okay, thank you, Trinity, fellow panelists, all the participants, ladies and gentlemen. I would definitely first want to thank you for inviting me to address this key topic on addressing equity in family planning, looking at the perspectives of policy and the planning perspectives. We could have the next slide. So on the Ugandan context, definitely our experience that we've just concluded the implementation of our first costed implementation plan, and which was derived definitely based on evidence. And we are currently in the process of developing the second CIP, and which will run from 2021 to 2024, 2025. And we've done this through a process. We first evaluated the previous performance, and we've looked at the national landscape reports, the research for scalable solutions, the PME assessment, and equity analysis, which have all been done. And this gave us that we came up with about 6 priority areas on the aspect of demand creation, service delivery, commodity security, stewardship, policy and enabling environment, and the financing. And we've engaged a number of stakeholders to address priorities for policy, implementation, and evaluation. So we had 2 consultants, one to review and then one to develop, assisted with Avenir, which is an international organization which is working with us. And the partners involve both the users, NGOs, the civil society organizations, partners, the academia, and then definitely led by the Ministry of Health and all the other Ministry of Education as part of the multi-sectoral action. Next slide. So this slide just shows really the process, which I think already alluded to, the evaluation of the previous CIP, and then looking at the situation analysis. We looked at what were the barriers and the enablers in the first, and we did this that was done through a stakeholder validation, and we came with the priorities which I've indicated. And this guided now our family planning goals and the modeling which has been done, and we have come up with the strategic priority areas. And then we shall have an implementation plan and an M&E to be able to do this. And this has been coordinated by the Ministry of Health, of which I'm actually the chair of the task team. Let's have the next slide. So where are we where is all this anchored? It's anchored definitely on the reproductive, maternal, and neonatal child. And you know that we have a sharpened plan, which had about 5 strategic shifts, which are on the last aspect, which were addressing the broader context, ensuring mutual accountability, and emphasizing impact, evidence based on solutions, and increasing access to high burden populations, and the geographical focusing. So I think specifically for equities, I will focus more on the sub-regional focus to address inequities. So this it comes now on those 3 broad areas: the multi-sectoral collaboration for family planning as a social economic development issue. And that's how we are looking at it, and looking at the definite universal coverage and sustainability. And we came up with about 11 strategic outcomes. 3 of them, the first 2 definitely on aspect of multi-sectoral collaboration. The next 5 was on the aspect of universal coverage, and the next 4 on the aspect of sub-regional focus, which actually is key in addressing aspect of equity, which is improved quality of family planning, decreased teenage pregnancy, high impact practices, scale up, and the context of specific intervention to address sub-regional inequities. As clearly was highlighted by the previous presenter, you saw the analysis in the different different regions. But what is key that we have definitely to have multi-sectoral collaboration and also address aspect of universal coverage. Next slide. So how do we do this? Definitely this is based on data, as I indicated, evidence, and this is based on the 6th round, which were done by the performance management for accountability for family planning surveys, which are done. And we have done hotspot mapping for targeted programming, and indeed indicate the research for scalable solutions and other family studies. And this has been able to guide us in our development of the CIP and performance monitoring plan. And this is done, and this normally is done by the different stakeholders, which are not only the Minister of Health. Next slide. So in 2020, 21, 24, 25 CIP for equity, we are looking at definitely the multi-sectoral approach. We are looking at here the aspect of Minister of Education, Minister of Gender, because most of the young population, they are those which are outside school. So we don't need to leave anybody behind. So it means that we have to work with the Minister of Gender to see how we can reach those populations. And then we're working with the Minister of Education and definitely other ministries of finance, because we need the resources for this. We look at sub-regional focus to address regional equities. This is really key in that we've been able to look at how we can be able to have this aspect addressed, and this is mainly in the regions of to improve client satisfaction, the availability, acceptability, the quality, and how do we address the aspect of teenage pregnancy. So you need to incorporate age-appropriate sexuality education framework, integrated youth responsive services, and access and knowledge of young people on family planning, and also increasing availability of quality family planning and scale up in all our places. So we have strategic information generated and used for evidence based on prioritization and family planning programs, looking at the young people, first-time parents, and the vulnerable groups. Next. So definitely you will need stewardship and accountability, because you all know that we are constrained with resources, and this is why we are saying that operationalization of the National Reproductive Maternal Accountability Framework, and this will need to involve our implementation plan with the monitoring framework, with the priority core indicators, And definitely we have operationalized the scorecard at national and subnational levels. And we are having the assemblies, the assemblies for religious leaders, for young people, for different groups, those with disabilities, so that we don't leave any group behind. Next slide. Thank you very much. This is the last slide which I wanted to present, and I wanted to make it as short as that, just to arouse for discussion, in case there's need for discussion. Thank you very much.
Thank you so much, Dr. Olaro. And we know that we made a difficult task for you to speak to all those points in 5 minutes. But I think you did an excellent job of illustrating how you, as a decision maker, were able to take evidence and information about the who and the where some of these inequities may be being experienced, and translating that then into decisions about interventions for those populations in those places within the context of the CIP. So that was extremely important, and the importance of a multi-sectoral effort to both help develop the plan and, of course, to monitor it and to hold everybody accountable. So I really thank you for fitting so much into such a small period of time. We were intended to have another speaker, a wonderful young woman named Proscovia Oroma from Uganda, who is having some technological challenges joining us right now. So we're going to move on, and if she's able to join us, we will bring her in. She was also featured within the closing plenary yesterday, the Real Talk, Real Voices, Real FP. And if you missed that session, it was phenomenal. So you could go back and listen to her and to several other presenters. But to move us along, we would like to ask you one more time for some feedback, and thinking about what Dr. Olaro has just told us about, and efforts to really both identify inequities and formulate a plan. If you were convening a task force to tackle inequities in family planning in your country, which stakeholders would you want to ensure are not left out? So if you were using Menti already, that should have refreshed on your screen. If you're new, please go to www.menti.com and use the code 393177. And I'm seeing people already with super suggestions: community leaders, minority groups, non-citizens, first-time mothers, of course, young women, BIPOC women, unmarried youth. I love the civil society groups. This is really fantastic. LGBTQI. This is so wonderful. My goodness, you all have gotten the hang of this, because this is the most number of answers we've gotten, or perhaps this is really where many of our passions lie. So thank you so very much for these fantastic responses. And I think I've been alerted that Proscovia may have just joined us. So let me see if that is the case. Proscovia, if you can hear us, could you please unmute and turn your camera on? Let's see if this works. Wonderful, we see you. Okay, I'm going to introduce Proscovia then, and I will hand it over to her. So Proscovia Katrina Oroma lives in the Gulu district of northern Uganda. She's 19 years old and is a mother of 2. She joined an FHI 360 USAID Youth Power Action-led activity on adolescent girls and young women's mentorship in 2017, which she feels transformed her life by increasing her knowledge of health, including family planning, and increasing her self-determination and self-confidence. And we are so very happy to welcome her today for her to share a few minutes of her story and her experience. So over to you, Proscovia.
Yeah, thank you very much. Greetings to everyone in the conference. My name is Proscovia Katrina. I am 19 years old. I come from Gulu district in northern part of Uganda. In my teenage year, I suffer some disadvantages, such as lack of access to information and services, lack of parental care, love and protection by my parents, and safety from the danger of gender-based violence. And lack of adequate knowledge on family planning, which led me to have 2 children unplanned. Later on, I joined Anyakamakwiri programs, which transformed my life. And that program has also kept me. Later on, I joined Anyakamakwiri program, which transformed my life. And I've gained several life skills and knowledge, including family planning, which has kept me from getting children where I have not planned for. And I call upon leaders in the district and the country where I come from and all over the world to take over CHAS program for adolescent, to take over CHAS program and promote such program for adolescent girls and young women in the community and all over the world. So let us work hard to eliminate all barriers and promote. Let us work hard to eliminate all barriers for adolescent girls and young women in the community, and this program, let us work hard to eliminate all barriers in all over the world. Such program has helped. It has a very big impact in the life of young girls and young women in the community. So I call upon leaders in the district and the country where I come from and all over the world to take over CHAS program and promote for adolescent girls and young women in the community. Because this program has big impact for the people like me. I am now a mentor and I can sustain myself economically. Finally, let us work hard to eliminate all barriers to the access of information and services and self-employment. Because let us work hard to eliminate such barrier to the access of information and services for adolescent girls and young women in the community. And also, let us work hard to eliminate such access of services like services for reproductive health and self-employment for a better life of adolescent girls and young women in the community. And let us also involve our parents and we sensitize our parents on child protection. And also let us involve our men. We sensitize them and also some services we have to offer for them, like HIV testing, cancer screening, condom distribution. And also we sensitize our men on family planning so that we have a better home and a happy family. And to add on that, we have to sensitize our men because like me, I can be having a knowledge on family planning, but if my husband doesn't have, it will not even allow me to go for family planning. So we have to sensitize them so that we have a better home, we communicate well, we move on together, and we sustain our family economically. Because if we have many children, we cannot manage to move on with them well. And sometimes they will also, a man, let me tell you, a man, if you have many children, that man will also leave you, will go for a better life somewhere. And that man will also get a woman who is like having 2 children who is not even given birth, and spend all of his life that side, leaving you suffering with the children, carrying all the responsibility. So let us sensitize also our men and parents for a better life of young girls all over the world. My appreciation goes to USAID, FHI 360, Youth Power Action for the great support they have offered. Thanks.
Thank you so much, Praskovia. I'm so glad you were able to join us despite the technical difficulties. And once again, for anyone who was not able to join the Community Voices panel yesterday, please do tune in and hear more from Praskovia. But I think she did a wonderful job of articulating the need for those programs. So formulating the plan to address those inequities and obviously heartfelt and from direct experience. So thank you very much, Praskovia. I'm going to hand it over to Helen to introduce our final session of speakers now.
Great, thanks, Trinity. Next, we have a couple of brief presentations. The first is from Dr. Rhoda Juane, a professor and dean at the Makerere University School of Public Health. She is a core partner on the R4S project. As the R4S lead at Makerere School of Public Health, Dr. Juane supported the engagement with the Ministry of Health to discuss results of equity analyses and their potential to form family planning programming, including the forthcoming CIP and future monitoring mechanisms. She will be talking to us now on how we can measure and monitor progress of family planning programs. The floor is yours, Dr. Rhoda.
Thank you, Helen, and greetings to everyone. So I will be sharing my experiences, building on what the previous presenters have shared, and especially Dr. Olaro, that has so eloquently presented what happened in the Uganda process of identifying and addressing inequities. Next, please. So as all the previous speakers have mentioned, in order for us to be able to address equity, we need to be able to use evidence to improve our programs as well as our policies. And for this, we need to start by identifying who is it that we might be leaving behind, where and why, what is it that is driving this, so that we are able to identify appropriate interventions to bridge the gaps. Once we have the evidence, we need to ensure that we engage with the policymakers. We are able to get the evidence into the policies as well as the plans, like the example that Dr. Olaro has just shared with us. So in the plans, we need to also clearly articulate what interventions are we going to use to bridge the gaps in inequity across the groups, the most disadvantaged groups, to bring them up to speed. And then we need to ensure that these plans are implemented effectively, because quite often we have very good plans, but we don't always implement them effectively. And so we end up with the perpetuated inequities across certain groups. And then finally, we need to be able to monitor and evaluate these plans. Are we actually making progress? Is the inequity reducing? And this is really going to be the focus of my discussion. Next, please. So we need to be able to evaluate the policies as well as the programs in terms of whether or not we are making a difference. And to be able to do this, there are several areas we should be interested in. We need to know whether the interventions are working. Who are they working for? Because sometimes we have very good interventions and they don't always work for every group as well. So we need to be able to know for whom these interventions are working well. We need to look at the issues of how effective they are in terms of improving utilization of services, the demand satisfied, and several other outcomes, the cost effectiveness, the impact, as well as the sustainability of the programs. And we need to monitor whether the inequities are reducing, and if there might also otherwise be emerging inequities, because sometimes we bridge the gaps and then we end up leaving certain other groups behind as the context changes. So we need to be able to look out for this as well. Are there changes in the underlying drivers, the barriers to service utilization? We need to be able to monitor these over time. Next, please. In terms of tracking of inequities, there are various indicators we can look at, and we can look at, for example, the levels. We can look at the trends, and in terms of reduction of the disparities over time. Is it changing? Ideally, what we would like to see is that the groups that are most disadvantaged have a faster rate of progress than others that are much better off. So we need to be able to look at the not only the levels, but also looking at the trends and trying to check whether the relative differences over time are also changing, as well as the absolute differences across subgroups. Next, please. So what data sources can we use? This has been highlighted ably in some of the questions that we've been answering and by previous speakers. The most commonly available data sets are the demographic health surveys, but there are also routine service data like the health management information systems, data from specific programs. Implementers can also be used, as well as surveys like the PMA, and we have used some of these in our experience in Uganda. But we can also have targeted evaluations of programs and research to be able to track equity. Next, please. So in our example, what we've just done in Uganda using the R4S project, we worked with various data sets, the demographic survey, we worked with the PMA data and did analysis of various indicators, looking especially at the demand satisfied across various groups by region, by age, and other parameters. And then we also followed this up with an engagement with the stakeholders to get their perspectives of why they observed differences, so that we can understand qualitatively the underlying issues as well. And then we did a literature review for the past 10 years, also to see what was emerging from the published as well as grey literature. So we compiled all these, and we followed this up with a large stakeholder meeting, which was convened by Dr. Olaro and other colleagues from the Ministry of Health. And we discussed the emerging findings and what should be done in terms of bridging the gaps. But we also discussed the gaps in evidence and what we can do to be able to bridge these gaps, and also came up with priority questions for us to answer to address the gaps in evidence and be able to support the next costed implementation plan. So we came up with a research and learning agenda that has been integrated with the M&E components of the costed implementation plan. Next, please. Next, please. Finally, I'll just highlight some of the strengths as well as weaknesses in terms of monitoring, and highlight areas where we might want to pay attention to and invest more to be able to continue to monitor equity. We can see, for example, that we have a lot of available indicators that we can use to monitor equity, and also data sets available across countries that we can use to measure equity within and across countries. And then there's also a growing interest in using evidence to improve policies and programs. So whereas we are not yet there in terms of integrating the evidence, there's growing need for this. But then we also have a number of gaps and challenges. As we continue to innovate and new programs emerge, we need to also continue to look into how we are measuring equity, the indicators that we can use, so that we can be able to generate good quality data that we can use to monitor programs. There's also challenges in terms of variances in the indicators that are being used across programs that make it very difficult to pull together this data, especially the routine service data, and use it to monitor equity. So these are some of the areas that we perhaps need to pay attention to if we can improve the monitoring of programs. There's also ensuring that we can generate timely data, because some of the surveys that we rely on, like the demographic surveys, take quite a bit of time before they are conducted, and so other surveys like the PMA contribute a lot in terms of bridging this gap. But then we also still have challenges with capacity to be able to analyze data. So some of the tools like what Kaya shared are really useful in terms of simplifying this process. But certainly there is still a major gap in terms of capacity to analyze and interpret the data, but also ensuring that we tailor our programs towards the gaps that we identify. But also finally, we have a number of challenges with the data that we have. Some of the disadvantaged groups are often also left out within the surveys that we do. For example, the youngest children, the youngest people between 10 and 14 years are often left out of some of the surveys. And then some other groups like those that are disabled are always perhaps almost always left out of some of the largest surveys. So we need to pay attention to what is available for us to be able to measure this very well. Thank you very much.
Thank you so much, Dr. Rhoda, for showing us the very many ways we can tell if our programs it's really making a difference. Next, we will hear from Frederick Mubiro. Frederick is a technical advisor in FHI 360's Research Utilization Department. Fred supports the R4S project as well as Introduction and Implementation Science related to DMPA-SC. He's based in Uganda, where he's a member of the DMPA-SC and Self-Care Experts Working Groups. He will be giving us pointers on how we can start and drive this conversation within our countries and also engage in bidirectional global dialogue. Welcome, Frederick.
Thank you, Helen, and thank you very much all the people who have managed to attend this side event on advancing equity to support universal health coverage, tools and approaches for next generation family planning. We've listened to a number of speakers this morning, and most of these have, for instance, our USAID colleague defined equity, but also she re-emphasized the importance of addressing access for equity to happen in family planning. We've had colleagues from the Ministry of Health, like Dr. Olaro, who is from the Ministry of Health Uganda, who spoke about how the country has used evidence, including that from the Research for Scalable Solutions project and Makerere School of Public Health, to inform planning in terms of the CIP for the next 5 years that the country is working on. We've also heard from our community voice, who is Proscovia Katrina Oroma, who spoke about her experiences, but also why prioritizing equity within family planning programs, and in particular, when we are thinking about UHC, how that will benefit people like her, young people like her, but also young women, so that they can attain their desired dreams, both in terms of reproductive health, but also in terms of in their life. We have been introduced to the Health Policy Plus tool, which can be used to identify inequities in family planning within countries, and it can provide guidance for formulating a plan, including the selection of high impact practices to address the inequities and how we can monitor progress. And I noted from this submission from Kaya of HP Plus that the tool found that women in the Acholi region, which is the region where Proskovia or Roma lives and participated in the Anyaka Makwiri Adolescent Girls and Young Women program. In that area, it found that inequity was found for women in all dimensions. So it shows you that this is an important tool, and it reflects that the actual experiences that people like Proskovia are experiencing on the ground. We've heard finally from Professor Rhoda from Makerere School of Public Health, the Dean. She's talked to us about how we can measure equity and how it is important, why it is important to make plans, but also to implement them, and eventually to measure, to be able to say, who are we reaching or who are we not reaching? And in that case, who are we leaving behind? It is therefore important for us to start thinking about and being intentional and explicit in how we are going to address inequities in relation to access to quality family planning information and services within our respective geographies. And Professor Rhoda mentioned how here in Uganda, the Makerere School of Public Health through the Research for Scalable Solutions project facilitated discussions between stakeholders, the Ministry of Health, and these discussions led to the adoption of evidence into the development of the costed implementation plan for family planning, which is going to be for the next 5 years. And Dr. Olaro spoke to that also earlier. As the Research for Scalable Solutions project, we will continue to support the generation and use of evidence to support discussions on equity at country and global level. And I would take the opportunity at this point to mention that we are introducing a strategic planning guide for creating inequitable access to family planning information and services, which is a guide that was developed through consultation and deliberation with technical experts in family planning and and it shows that health equity and builds upon the discussion paper on equity in family planning developed under the Partnership for High Impact Practices for Family Planning by Hadi and others in 2019. It is intended to guide program managers, planners, and decision makers through strategic planning processes to identify and develop approaches to reduce inequities in family planning. With that, I would like to call upon us to continue the discussion on equity, which we have started. It should not stop. And I want to leave with a statement from one of the panelists, Professor Rhoda, to say that again, that it will not help us only to plan, but to implement and to evaluate so that we can reach all the groups. Thank you so much.
Thank you, Fred. And thank you to all of our speakers today. And thank you, all of you who were able to tune in. We do not want to keep you from the opening session of day 2 of the ICFP forum. So we will just quickly say thank you so much. And please do stay tuned. We will make this recording available, and we will be tweeting and sharing information as R4S continues to advance the dialogue on this important topic. So thank you to everybody, and enjoy the rest of your day. Bye-bye.